Okay, good morning, everybody, or should I say good afternoon? Trying to look and see who's on the call. Yeah, everybody's muted, so let me see if I can sort that out.
Don't know what you lose in your case.
Good afternoon.
Good afternoon.
How you doing?
How you doing? I'm great. How you doing? How's your week been?
Not too bad, not too bad, not too bad.
Okay. I'm trying to get this thing so I can see all of the pictures whilst people come on. Oh, it's been a very busy week, you know, because it's awareness, sickle cell awareness.
Yeah, man, I was just thinking that you never stop, man.
I'm telling you, today I've got another interview on when is it? On Wednesday.
Okay.
Yeah, on Wednesday, and then that's it. And then we're concentrating.
No.
You know, now we're concentrating.
I've heard this that's it before. I know that's it. Nah, I ain't taking that from you. Nah.
No, listen. No, what it is, it's already arranged. It's
and try not to overdo it. There's no point in telling you not to. Just do you. Try not to overdo it. Don't give me none of this. That's it. No.
No, what it is
you've been saying that's it for 3 years. 3 years. You've been saying that's it. I'm gonna do this week, and that's it. I'm gonna do nothing else. That's 3 years ago.
I can't. It's
so
like,
don't worry. Just don't say it.
No, what it is, we've got Neville Clare's memorial coming up, so we want to address.
That's fine. Okay.
I'm just trying.
Let me let you get on with it. I'm gonna be on the call, but like I sent you, got the message I sent you, don't you?
Sorry, say that again. Pardon?
You got the message I sent you on WhatsApp, didn't you?
I haven't seen it yet because been trying to sort out the volume on this thing and so forth. So yeah.
Cool. All right. I'm here. I may not have the video on all the time, and I may not be as interactive because I'm jobbing today. I'm preparing to head out, but I'm gonna be here with you guys. Yeah.
Okay. All right. So good morning, good afternoon, everybody.
Good afternoon, Kiwi.
Okay, who's that? Hilda?
Yes, good afternoon. How are you?
I'm very well, thank you. Where are you from, Hilda? Where do you live? What area?
Oxford.
Oh, right, you're from Oxford. Okay. How did you hear about this meeting?
I get the links. I don't know whether I got this one through Sandy from the hospital or through Sickle Cell Meet Society.
Okay, so it's been.
I'm not. I get a couple of messages because we have one candidate family day tomorrow.
Okay.
But I got it. I am logged onto something now. I'm not so sure. I get so many communications, so whenever I can make it, I do it.
Yeah. Are you a warrior, or do you have sickle cell in your family?
I have 2 sons. I'm a mother of 2 sicklers.
Yeah. Okay. Well, welcome. Thank you for joining us. You know, I'll just give it about 3 more minutes or 2 minutes and then make a start because it is 1 o'clock.
Okay. Yeah. Let's wait for the others.
Yeah. What we find good with Zoom, the fact that you're in Oxford. If we was hosting this meeting normally, our normal open house meetings, which is held in Tottenham, it would have been a journey. Yeah. You may not have been able to make it because of the distance.
No, usually I can't make it.
Yeah. Yeah.
Usually I can't make it, but we have a group, we have a WhatsApp forum of children who attended the sickle cell camp in 2000,
Mm-hmm.
I think 18. When did you go, Sickle? 18.
Yeah, I was 18.
Yes, in 2018. They are always updating us of any activities that are going on, but because we are way far, I'm out of London area, I am never able to attend.
Mm-hmm.
That's why I said that I need to make sure I attend this one for as long as I can.
Okay, brilliant. Okay, well,
Yeah,
we're gonna make a start now because like people's time is, is important, is precious, so,
yeah.
I will make a start. Who wants to join as they come in? They'll just be allowed to enter, without issue. Okay, so. Right, first of all, I want to welcome everybody that is on the platform today. Thank you so much for joining the Sickle Cell Care Advocacy Unity Support with Empathy Group. This is the year 2000's collective offering to recognize World Sickle Cell Awareness Day, which actually took place yesterday. We actually believe in sharing sickle cell information every day. And following up from our YouTube presentation yesterday, today you are all invited here to listen to the voice of the sickle cell community and to also share your own voice. Basically, my name is Samantha Greaves, for those who don't know, and today I am your host. So I'll begin with some housekeeping. Just so you know that this meeting is being recorded, and we record it for our archives, and so that when we're doing our minutes, we can we have an accurate account of minutes, because we can't meet up. We need an accurate account of minutes when we have our meetings, so the recordings assist with that. They're not there to be shared out for people. This is an actual meeting, so it's not for sharing. What else? I'm going to mute everybody soon because just to avoid sound pollution, to combat noise pollution, I should say. And we have a full agenda today, and I hope that everyone that wishes to contribute has the opportunity. Therefore, please use the chat box. Please leave any questions or comments that you have in the chat box. And if you want to openly ask questions later on, make it known in the chat box so we can come to you, so that you have the opportunity to speak. What else? All right, the duration of our normal monthly open house meetings are 2 hours. However, because we're hosting this special gathering in recognition of World Sickle Cell Awareness Day, we want as many of you to be able to the opportunity to share what you want, if possible. So it's likely we may run a little over time, but we will try and keep to time, right? And to save time, I have sent everybody that pre-registered, our YouTube interview yesterday, which explains what is sickle cell. So if you haven't done so already, we ask that you please take time later on to watch the video, and to share it with your friends, because as I said, it basically it saves time today, so we don't have to repeat information, about what is sickle cell, because you guys will already have it. Okay, moving on. Today, our meeting moderator today is our group's chairperson, Leanne Palmer, and we have 2 special guest speakers today and a number of individuals from the sickle cell community who will also share. So before I run through the agenda today, I'll begin with our theme for today. All right, so today is all about sharing awareness. So to begin, I'll share a little bit about myself. Right, so today is Sickle Cell Causes offering is related around cause and effect, and that is the cause of mental anguish, anxiety, and trauma. Also, lack of education or sickle cell awareness, whereas ignorance costs lives and definitely causes mental trauma. Also, our meeting today relates to the current times of isolation and depression, and how we must use these times for repair, and also to make concrete changes and grow using unity in our community, education, the resources we have around us, and to ensure, basically get together and ensure that this happens. If we don't move now, it's like we never will. Right? Sickle lives are being lost because of sickle ignorance, and the changes need to happen now. So basically, as I said, for those that just joined us, my name is Samantha Breeze, and today I'm your host. I am a community volunteer, and I'm also a sickle cell warrior. I prefer the term warrior opposed to sufferer, sickle cell patient, or even sickle cell survivor. I am a mother and also a grandmother, and these 2 points are the most precious, empowering offerings to society that I have been gratefully allowed to provide, to the world, being a mother and grandmother. And it's a gift, and that is really because I didn't envision being able to be a mother when growing up. But I was diagnosed at 4. I know some of us are going to share a bit about our stories today, because it's all about sharing. So I was diagnosed at 4 with having sickle cell anemia. My mortality date was said to be between the ages of 14 to 21 years. So as well as growing up and living with the daily pain, and multiple symptoms and treatments and operations, I've also lived with the underlying trauma that each night could be my last. I've been a community volunteer since '97, and I'm currently writing my book, and I hope to have that finished next year. I'm an active member of the Gift Genius African Heritage Wealth and Power Program, where we assist to create real wealth in our communities as far afield as Africa. And I'm also the founder and current group coordinator of this organization, Sickle Cell Cause. Right. So many of us here today already know that World Sickle Cell Day was established by the United Nations and in a General Assembly in 2008 in order to increase the awareness about the sickle cell disorder and its ambitions for a cure amongst the common public. It was celebrated for the first time. I was gonna, if I can ask them if people can actually mute themselves, because I keep hearing like background noise. Right. Yeah, it was celebrated for the first time on the 19th of June in 2009. So yesterday groups and individuals were working together and individually to share awareness collectively worldwide, for the 11th year since Sickle Cell Day was actually founded. However, because we must never forget the initial works, for community-based sickle cell support and research, in the UK and Europe, I think it's important that we recognize the passionately and powerful, man that created Oscar, the first ever sickle cell awareness research and support organization, the Organization of Sickle Cell Anemia Research, which was created and founded by Neville Clare, who was a sickle cell patient. He became an advocate, and he later on achieved his doctorate. Okay, basically, I'm actually glad to see that his legacy, this is him here, that his legacy is still living on 46 years since the conception of Oscar, and there's still many Oscar groups around the country. 46 years later, under the umbrella of many other sickle cells organizations, such as Sickle Cell Cause, there's many other groups, actively sharing sickle cell awareness throughout the country and throughout the world. So we have to look and, give thanks to people that walk the walk before us, that laid down the foundations, So, I just want to raise up the name of Neville Roy Clare. I've been passionately and, supporting my sickle cell peers for many years, because I still have uncomfortable childhood memories. Now, as I said, like today is about sharing awareness and information, so we have to go a bit deep. Like, for instance, I remember during my childhood spending many playtimes and lunch breaks huddled up close to the door, as possible, after exhausting so many means or every means of trying to gain entry back into the building and being thrown back out into the cold. Because basically, when I was growing up in the 60s and the 70s, playtime, and lunchtime meant get outside, and stay out there until lunchtime is over or break time is over. So no matter what the climate, whether it was sleet, snow, rain, thunder, lightning, you had to stay outside, until these his break time was over. The fact that I'd be bawling out in pain, sometimes having even wet myself, only added anger and mockery, you know, from my teachers. And it was very embarrassing and shameful amongst my peers. So anxiety and depression were basically my challenges growing up at that time, you know, even if I didn't realize it at the time. You may be wondering if I actually said, you know, I wet myself, you know. Well, yes, I did say that. Today is about honest sharing. And throughout my childhood, wetting myself was a regular occurrence. You know, I'll say this, having an enlarged spleen and swollen stomach and having a smaller than normal bowel, and, you know, are just a couple of the symptoms of having sickle cell anemia. Parents may notice that their warrior children often wet the bed until quite late in life, you know, even up into their late teens, you know, because the bowel is unable to hold the average amount of fluid, and that can leak out during sleep. And then there's the cold, you know, when your joints are aching and you're, you know, sleeping and, you know, your bowel's not holding the fluids, you know, it's too painful to even get up. So you find yourself, you know, it just happens. It's not, it can't be helped. And those are some of the embarrassing extreme conditions that that cause anxiety that the sickle cell child, you know, warriors, you know, have to undergo. Right. There's also extreme conditions like sudden changes in weather, you know, but especially the cold, you know, amongst other issues, are the cause of many sickle cell crises, you know, and each crisis is actually a threat to your life. A sickle cell crisis can take your life. It can cause death. So every sickle cell crisis is, you know, is a death threat. You know, that is the reason why people call themselves sickle cell survivors, you know, sickle cell warriors, because a crisis is a blatant attack on your life. You know, sadly, a lot of fatalities are not always recorded due to the patient having sickle cell, and is often recorded, you know, for like the cause of the actual death. Sickle cell patients have many, you know, sickle cell comes with many different, you know, illnesses and conditions like stroke, you know, aneurysms in your head, you know, pneumonia, chest infections, you know. So if you was to die and you had stroke, you died of a stroke, they would not put sickle cell anemia on the on the death certificate, you know. And this, you know, keeps the sickle cell death numbers down. And that's one of the reasons why sickle cell is not recognized across the mainstream as the death, you know, the serious condition that it is, right? Because the records of deaths is not out there, you know. So it just seems like a huge amount or a small amount of Black people are complaining about pain every so often and, you know, needing a bit of extra help, but it's not recognized that it is the extremities of what the condition is, because the sickle deaths are not recorded as sickle deaths. You know, it was like if somebody thinks they're obese but has sickle cell, you know, and they pass away, it'll be down to obesity or diabetes or high blood pressure. We need to have sickle cell registered on death certificates. And since our conception, our organization has been campaigning, I should say, we've been complaining and campaigning, I should say, you know, for deaths, you know, sickle deaths to be recorded as such, you know, because I said the lack of these figures, records ensure the figures are kept down, you know. However, let me go back to myself. Being a patient, you know, because of patient-led organizations like OSCAR, the Organization of Sickle Cell Anemia Research, many advancements have been made in the sickle cell, you know, community world in the UK. And I am proud that Neville Clare over there was my actual sickle cell mentor, you know, and he was my friend. You know, in fact, it was him that actually encouraged me to create Sickle Cell Cause, you know, and he worked with me like every week, every Sunday, 4 o'clock. You know, he was very strict when it came to time, you know, mentoring me. And that was up until his death, 6 months before his death, you know. And next month is the, marks the 5th anniversary of Neville's passing, you know. So Sickle Cell Cause will be hosting an online memorial in his honor. And I will ensure that everybody that's on this meeting will be invited. So if anybody on this meeting actually knew Neville personally, please contact us so that we can so you can be included with the sharing of the tributes. You know, we want to make it a special day and keep it in our archives, you know, and share with his family, you know, so that his name is, you know, never ever forgotten. Anyway, moving on. For me, it's very challenging volunteering, you know, for this organization because it is time consuming. You know, I find to support such an unbalanced and unpredictable illness, you know, especially when I live with it myself, you know, causes added issues. But I do feel a deep passion and a sense of duty that I can't ignore. So I am saddened with the amount of NHS cuts, you know, in the medical services and in the environments that were created for sickle cell and thalassemia patients, you know, especially over the last 3 decades. We've worked seriously hard and we fought and, you know, campaigned, you know. So it saddens me because these cuts and these attitudes has resulted in many loss of lives, you know, many friends have lost their lives, people that we know, and know people in the sickle cell community, which is very traumatizing in itself, you know, but it also, you know, leads to people like myself and my volunteer peers in sickle cell cause having to spend many hours a month advocating again and again to regain and replace and retain what was already fought for, you know, so hard by sick people, you know, and small teams of supporters. And never leave out our supporters. Without them, we would never achieve as much as we do. But having to go over old ground, you know, consistently, you know, is not good for, you know, one's mental well-being. You know, the removal of the lack of services is a direct, you know, attack to the sickle cell, you know, patient, and much trauma and anxiety and sickle deaths is caused. Sickle deaths are actually caused by anxiety and trauma, I should say. You know, and as I said, the winter months are the most painful, you know, and traumatic and life-threatening for most. It is important that schools and work environments are educated about sickle cell anemia, not only to reduce, you know, the type of mental and physical trauma that I personally suffered as a child, you know, but just to wipe it out, you know, education is key. Anyway, I've taken the liberty of emailing people that pre-registered, you know, copies of Professor Simon Dyson's guides for managing sickle cell in schools and the workplace, you know, and again, I ask if you guys can share these far and wide, because that, you know, is about awareness, sharing, you know, the information we've got, because if schools and teachers and employers, you know, and employees, you know, colleagues are aware of sickle cell, you know, life would be a lot, you know, easier, you know. Finally, we at Sickle Cell Cause are very comfortable with our status as a real grassroots community group. You know, we are community. We're not looking for any OBEs or anything like that. We are working in our community, serving our community, you know, and we will continue to liaise gratefully and rely gratefully on, I should say, our community, you know, for our support. Right, at this point, I'm going to share my screen now, you know, to begin with today's offerings, and so our speakers can be introduced, you know. So if you just bear with me, try to work out how to work this thing. All right, share screen. Okay, let me just take my camera off. That always helps. I actually forgot I had it on. Okay, so there's a picture of Neville Clare. You know, he's created OSCAR, the first sickle cell organization in the UK and Europe. And this is our home, the George Marsh Centre, which we're fighting hard to keep. Right, so today is our agenda is, well, I've done my host introduction. Everybody now knows who I am, you know, and then how can you, our community, support the cause? You know, then there's who is SC Cause, you know, and then SC Cause community updates by our chairperson and from our advocacy department today. You know, then Professor Simon Dyson will share his guides for sickle cell awareness in schools and the workplace. You know, then we'll have a question and answer session, and Simon can answer your questions via phone, you know. And then our peer counsellor, sickle cell warrior counsellor Daniel Gunn, will be sharing how to cope with trauma and anxiety. We'll have the voices of our community, you know. So moving on, let's get started. Right, so as everybody knows, I always start with how can you, our community, help the sickle cell community? First of all, we always ask everybody if you can please donate your blood. You know, this is the national database telephone number, 0300 123 2323. Next, get tested for sickle cell anemia. You can find the George Marsh Centre, 0208 702 6630. I'm just going to see if I can mute everybody. That's better. There's a noise. I don't know where it's coming from. I don't know who's not muted. Okay. Okay, next we have, please, if you've got a couple of hours a week per month, please can you support, the sickle cell community via Sickle Cell Cause, sicklecellcause@gmail.com. Participate on our community miles for sickle cell annual sponsored walk. We walk through Haringey, and this is an opportunity for us to raise awareness in our community, answer questions, and also it is the bulk of where we create our funds from to support our services, the many services that we advocate for and provide. Our sponsored walk this year is the 12th of September. As you know, we may not be able to have the sponsored walk due to social distancing, but we will keep the date free because we may do something online. When we get together, at our next committee meeting and volunteers meeting, we'll decide what we're going to do on the date. And if you would like to donate, any amount of money to support Sickle Cell Cause, especially our welfare department, we're with Barclays Bank under Healthy Living International Ltd, sort code 204657, account 034841114. Okay, so who are we? Who is the Sickle Cell Support and the Sickle Cell Care Advocacy Unity Support with Action Group? Right, I'm going to just take us through this very quickly. So the patient members and volunteers of this organization are medically treated under the Hematology Department of the North Middlesex University Hospital Trust, which is found in Edmonton. Over the years, there have been many dedicated lead volunteers helping to manage the affected community and volunteers to assist members of this support group in all aspects of their lives. The group has changed name many times. This is usual when a lead volunteer has ambitions for positive effect in the community. However, the basic model still remains within the accordance of the black print and legacy left by Dr. Neville Roy Clare, the patient founder of OSCAR, the first sickle cell support group in the UK and Europe. In January of 2015, this group was upgraded and renamed the Sickle Cell Care Advocacy Unity Support with Empathy Group, and derives its name by using the updated and necessary services provided and the passions used to deliver these services. The first letter from these named services and passions have been used to create the acronym CAUSE. Therefore, that's why we're more commonly known as SC CAUSE. Our team of patient volunteers execute our aims and objectives seamlessly because we are supported by our wider community. We've got a great team of sickle cell supporters, and we have good relations and mutual respect with our clinical care staff stationed at the George Marsh Centre. So we are currently working to support the sickle cell patients in the following areas, assisting patients with, complete family welfare support, promoting well-being through the NHS, nutrition, healthy exercise and so forth, also education via workshops, awareness programs, seminars and webinars like this, and our advocacy, which is one of our strongest, things that we do, one of our strongest services. Our welfare department and advocacy department, as well as our awareness department, are the most busiest departments in SC Cause. Okay, so I hope that this information gives you a little idea of what it is that we do as an organization. As I said, I have sent out the video of what we filmed yesterday of what is sickle cell, and it has more detail of who we are and what we do. So at this time, I'm going to actually bring up the next speaker. Don't want to go into all, we've been awarded every year. A reminder that will be hosting Neville's Memorial next month. It will fall on the 18th of July. And we'd like to recognise Curtis Stewart, our late chairman, who passed away in 2017, and he was the first recipient of our Oscar trophy that we give out in honour of Neville Clare, to honour people that go over and above when it comes to supporting the sickle cell community. Right, so at this point, I'm going to pass over to our chairman for our chairman's address. Let me see if I can unmute you. Leanne, are you there?
Yeah, I'm here. I'm here. Thank you. Greetings all, and thank you all for being with us this afternoon. It's going to be a very brief update, just to let everybody know that we're still strongly focused at the moment on our advocacy campaigns, which primarily is, which has already been mentioned, is to save the George Marsh Centre. So the George Marsh, what we're actually fighting for is to regain 100% access and use of the centre, which was purposely built and is situated on the grounds of St Anne's Hospital. So for, it's been mentioned quite a bit, but the George Marsh Centre was purposely built for the sickle cell and thalassemia community in 1987 and was officially opened in 1989. And where we find ourselves today is that it's literally just being taken out from underneath our feet and being given to other health groups. So we're strongly fighting to get this back into our hands where it should be. So our petition is still open for people to sign, and I think we can give details on that later. So yeah, that's the main focus of our advocacy at present, is to save the George Marsh Centre. Also, to our second part of our advocacy campaign is about the halt to the MD and PhD egos, which has maybe 3 key parts to it. Firstly, the one being, we're fighting for the necessary policy to be written and adhered to for all medical students to be trained on sickle cell anemia prior to them actually achieving their qualification. And in addition to that, for all medical practitioners that are already in practice to receive sickle cell awareness training. We have so much issues with patients when they're dealing with their GPs, when they're going to accident and emergency services. There's so many medical professionals that still don't know what sickle cell is, which is just a disgrace in these times. The second part to the halt the PhD ego is about the policies that have been written but are not being adhered to when people are going into A&E. So we're fighting to make sure that that is actually adhered to, and what we want is, when it's not adhered to, there needs to be legal consequences, because sickle cell lives do matter, and a lot of fight and effort has already gone into putting these policies in place. They need to be adhered to, and so that's one of the strong things that we're fighting for. And then thirdly, for specialist wards to be reinstated in all teaching hospitals and in UK-based hospitals where there is a higher number of sickle cell and thalassemia patients. So those are our main key areas of advocacy campaigns that we're kind of working tirelessly on at the moment. And I think I'll kind of leave the update to that area of things.
Okay, thanks, Leanne. I'm going to move on because I know we've got such a big agenda today. Next, I'm not sure if Andrew Reid is on, but Andrew Reid is our advocacy advisor in our advocacy department, and he was going to share some words with us. Are you there, Andrew? I don't think he's here today. He hasn't. No, can't see him on. He's not on. But following that, we've got Duchess Carol Alonga, who is our she's new to sickle cell course. She volunteered, joined us this year, and she's helping, in our advocacy department, and she's been very, very powerful so far. So Carol, can you unmute yourself and share
Can you hear me?
updates, please?
Can you hear me? I've
Yes.
unmuted myself. I'm not sure. I apologize for my voice. It's gone, but can you hear me okay?
Yes.
Okay. Hello, everybody. It's a pleasure to join you today. And I'm honored to be a part of the Sickle Cell Cause Advocacy campaign and to join you all. I've known Samantha for more than 2 decades. She's my sister, and I've watched her and her family struggle with this anemia. So, with that in mind, when we reconnected, and I was invited to your AGM, I think it was last year or the year before that, and I attended a couple other events. I was determined to use the platform that I have to support your community, because I know that for decades the voices of the sickle cell cause group have been ignored. From my understanding, it's been ignored by government because you've tirelessly tried to get your MP, your councillors involved. Recently, I attended the mayor's question time with Samantha and a team. And again, it's like to no avail, so you're being ignored not only by the government, but also by healthcare professionals and etc. So, just knowing that the campaign is ongoing, and the campaign is ongoing by persons who are, warriors of this anemia. Like Samantha said, she's not going to call it survivor. She's not a survivor. She's a warrior, and I admonish you guys for the work that you're doing, considering that you're dealing with this condition. Okay. And the task of trying to save the mammoth task, it's exacerbating to know that you all are, for years, have been trying to save a building, George March Center, that was purposely built for you. That alone is just, it's a task in itself. Okay, so I'm delighted that, post COVID-19 pandemic afforded you all the opportunity to finally even be included in the on the government's shielding list of vulnerable individuals, because it's like you almost didn't exist in their eyes. When I hear some of the stories of persons suffering from this anemia, it's saddening. So I'm delighted that, finally they're recognizing you all as vulnerable individuals who need to be shielded. And to be honest, I think it's also due to the laborious work that you all have been doing and the campaigning that you have been doing and pressing on to make sure your voices are heard. But we are delighted, I am delighted, at least I can say, to know that you finally have a voice at the table of the persons who are at the top making the decisions for you. Because I'm a firm believer, based on my experience and work within the local authority in the borough where I live, and being on the procurement panels for the NHS and CCG, it was really an honor to be selected by persons within your community to stand and represent you as a patient liaison consultant. And following a Zoom meeting a few weeks ago with, I think it was one of the senior doctors who was the spokesperson for the North Middlesex Hospital NHS Trust, who said he wanted to support. And, by, I guess letting him know that it's important that this board they have, which consists of senior decision makers of the North Middlesex NHS Trust, that they need to have representation from sickle cell cause. And that's where myself and 2 other persons, including Andrew Reed, we have been selected to support on this particular board. So I'm delighted to know that you now have some representation on this particular panel of experts and doctors to actually liaise with your community, find out the needs of your community, and put that at the table so that they can take consideration when it comes to the decisions that they're making. Because they've already taken away your use of the Joe Smart Center, the full use, and I do believe that there is more going to materialize, because based on the information I've received so far from this doctor, is that they are, because of COVID-19, they're putting in place, I understand there are a number of measures that they are taking, such as a pilot scheme to comply with the NHS trust. But before that, I want to point out as well that I think they're going to have, I think the George March Center is going to be used not just for the sickle cell community, but also persons with other sickle cell, not sickle cell, red blood cells conditions. But until we get to the table, I'm not gonna have more information on that. But I know that they are piloting a scheme to comply with the NHS London infection prevention guidelines, which will give more freedom and protection for the patients. Because I understand that, you know, being having the sickle cell condition, you have a lower immune system. So the plan is to include these two pathways. So they have a green pathway, which is a COVID-free pathway. And then they're gonna have a COVID managed pathway, which is the blue pathway. So it is very important to ensure that, you know, persons with, you know, a low immune system, they need to be shielded, and they need to ensure that your safety is paramount, is first and foremost. So the pathway for the green, they will have like a high priority for patients in that department. And with these pathways that they are establishing, obviously the whole way that NHS staffing is will pre-COVID-19, the way they manage that, it has to change. Because, you know, I don't know if you've heard of bank staff, but you have bank staff, they work, it's sort of like agency, and they can work in one hospital today and in another at somewhere else. They're all over the place. So their schedule will change from day to day. And so, pardon me, with this green and blue pathway in place, it means that, you know, the restructuring and monitoring of their staff, probably regular testing, also persons having to be scheduled to work in a specific area for a longer period of time rather than working day to day. You know, so there are a lot of changes that will take place to ensure the safety first and foremost for the patients. But I do understand that they plan to include a number of red cells patient service open to other patients with a wide range of blood-related conditions. You know, so we'll watch this space. We haven't had our first meeting as yet. Being on the board, I know that a meeting is planned for the imminent future, but I look forward to doing my best. I also look forward to taking this particular charity to every single platform. I wear a number of hats involved at an international level, national level. And I'm going to be calling on my network to support as much as I can. I also pointed out to Samantha and her team that I think legal representation is very, very important. And I'm pooling, you know, my team of professionals to find out who will be willing to donate. We can't afford to pay anybody. So somebody with legal background, it's imperative that we get someone to stand and write those letters, or stand and be a spokesperson from a legal capacity to support the sickle cell cause group. So I'm optimistic and I'm looking forward to working with you all. And I think my voice is dwindling slowly, so I will stop there. Thank you.
Yeah, that's great. Thank you, Duchess. That's fantastic, and we do appreciate the efforts and the work that you guys, our liaison team, you, Andrew, and supported by Carl are doing, because we can't do it alone. As I said, like having the condition without supporters, able-bodied supporters, a lot of things cannot continue and get done. They stop, start, and that's why they are allowed to get away with certain things. So, you get well soon. I know the feeling. I woke up feeling a bit rough today, so we'll just struggle through. Thank you for for coming on, because you could easily have just curled up in your bed. I understand. So thank you for your input.
I'm passionate about the work that I do. In fact, my voice is gone because I've spent a whole week in and out of presentations.
Yeah.
And so it's been a long, long week, but my heart, you all you're embedded in there now. So thank you.
No problem. Thank you very much. Okay, so guys, so we're moving on, and right, we got Professor Simon Dyson. He's visited with us a couple of times and shared his guides, sickle cell and thalassemia guides in school, health and safety, and for employers. Now, Simon Dyson is an author, a researcher. He's a director of the unit of the social study of thalassemia and sickle cell, and he's a professor at the De Montfort University. Now, what he's done, he's condensed his presentation, because his presentation usually takes 2 hours, and he sent us a recording of the presentation so we can play the recording, so you can get all the information. It's condensed, and it includes both in the workplace and in schools, and then he's going to be on the call, on the line after the fact, after the presentation's finished, to answer all your questions. So if you do have any questions, please put them in the chat box. Our moderator is Leanne, and she will, ask Simon any questions that you have, that you raise. Also, if you've got comments, put them in the chat box. And for now, I'm moving on. I'm going to play Simon Dyson's presentation of sickle cell in schools and the workplace. Let's hope this works. Okay, can you guys see my screen? Leanne?
Yeah.
Okay. I'm not very technical, so. Okay, if you guys got pens and paper ready so you can take your notes, and please ask your questions. It's about awareness today, so awareness being shared. Thank you. This is about 30 minutes.
My name is Simon Dyson. I'm a Professor of Applied Sociology at De Montfort University in Leicester. This talk is going to cover sickle cell in schools, sickle cell at college and university, and sickle cell in employment. The talks on sickle cell in school and sickle cell in employment are based on research. The information and ideas on sickle cell at college and universities is based on information that we've picked up either in the schools or the employment research, together with our own experiences of working with students living with sickle cell disorders at our own university. To begin with, the sickle cell in schools research was based on data that were collected around 2008-2009 with school-age young people living with sickle cell disease in England. We first asked young people with sickle cell how many days of schooling they missed through sickle cell related illness alone, bearing in mind that young people with sickle cell may have other non-sickle illnesses that force them to be absent from school. So this was sickle cell related illness only, not other illnesses, and not counting other time out of school for hospital appointments or regular blood transfusions. On average then, what statisticians call the mean, children reported missing 16 to 17 days of schooling a year. To give you a baseline comparison, the overall average for all children is somewhere around 5 days a year. The figure of 16 to 17 days is important because it is more than the 15-day threshold beyond which a school is obliged to make alternative arrangements for a child's education, such as home or hospital tuition. However, we also also asked, whenever they were absent from schools, how many days in a row were they typically absent? The most frequent pattern, what statisticians call the mode, was that a child with sickle cell disease missing school would miss 2, 3 or 5 days in a block at a time. So they would miss 2 days from school and then return to school. The following week they might miss 3 days and then return to school. A few weeks later they might miss 5 days of schooling and then be back at school again. What was happening was that they were missing schooling in short, sharp bursts, and cumulatively, adding up all the absences over the whole school year, this was often far more than the 15-day threshold that should have triggered extra support. However, at the time we did our study, many schools were interpreting the rules in a very restricted way to mean 15 days in a row. This meant that some young pupils with sickle cell may have missed out on the support that they were legally entitled to. So, young students with sickle cell were missing a great deal of school. How much did they think the school helped them to make up for this missed time? We asked them a specific question about how much they thought they were helped to catch up, on a scale from 0 to 100, where 0 represented I've not been helped to catch up anything at all that I missed, and where 100% stands for I've been helped to catch up everything that I missed, and where 50% indicates being helped to catch up about half of what they'd missed. As you can see, hardly any pupils with sickle cell felt they'd been helped to catch up everything that they'd missed. Only 6%, in fact. At the other extreme, nearly 1 in 5 students, 19%, with sickle cell stated that they'd not been helped to catch up anything at all. In fact, if we take the 3 columns on the left of the bar chart and add them together, the 19% plus 31% plus 31%, which comes to 81%, we can say that over 4 out of 5 pupils with sickle cell felt that they were helped to catch up half or less of what they had missed. So, the story so far, missing a great deal of schooling owing to periodic illness, but not perceiving that they were being helped to catch up. We then asked a series of very specific questions. My team of researchers at the time were slightly puzzled about why I wanted to ask these very specific questions. But the reason was that I've sat in sickle cell support groups for over 30 years and heard the same complaints from mothers of children with sickle cell, and nothing seemed to be changing over time. Sometimes the mothers would say that they raised these issues, but they were dismissed as a one-off, or that this was only happening to their child as an exception to the rule. And so I wanted to find out just how widespread these experiences were, so that they could not be dismissed as just a one-off or just as an exception to the rule. We know that young people with sickle cell disease cannot concentrate their urine as readily as normal. They need to pass large quantities of dilute urine. And yet, 57% stated that at some time they had been prevented by teachers from using the toilet when they needed to. One of the main pieces of health education advice that a young person with sickle cell will receive from their consultant paediatrician or their specialist nurse when attending a clinic is to stay well hydrated. Drink litres and litres of water to help them remain well. And yet nearly half of the young people, 46%, claimed that they'd been prevented from drinking fluids in class. Next, think of the main form of sickle cell disease, sickle cell anemia. The clue is in the name. A person with sickle cell anemia is severely anemic and likely to become very fatigued and tired far more often than the next person. They need to take moderate exercise for better health, but often they cannot undertake strenuous exercise. We had some reports of PE teachers asking pupils with sickle cell disease to dress in skimpy PE kit, with bare skin exposed to the weather, and then to go on a cross-country run, perhaps in cold, windy weather. If you were to design a situation to tip a young person into a sickle cell crisis, you could not choose a more suitable scenario, making them exhausted and cold in adverse weather. And yet, over 1/3, 36% of the young people we questioned stated that they had been made to do unsuitable exercise at school. Equally, their anemia made it difficult to hold concentration in class when they became tired. Some of them would do what teachers especially hate, which is to rest their arm on the desk, then rest their head sideways on their arm as if they were asleep. And because the teachers did not appreciate the reason behind their tiredness and lack of concentration, the teachers would shout at them that they were lazy. Again, over a third of young people said that they had been called lazy when in fact they were in fact simply tired from their sickle cell anemia. Finally, note the very large number of children with sickle cell who were saying these things. For example, over 300 children with sickle cell said that they were not being allowed toilet breaks or not being allowed to drink water. Now, the usual response I get when presenting this evidence is that we need to raise awareness among teachers and other school staff. If only teachers understood, goes the thinking, then they wouldn't let these bad things happen to children with sickle cell in their care. Unfortunately, life is not as simple as that. Our research showed that raising awareness was not enough. It was necessary, but it was not enough by itself. Looking through the statistics on the 569 pupils who completed our questionnaire, we found there was no link at all between teachers knowing that the child had sickle cell disease and the young person reporting negative experiences. So that may not correspond with what common sense suggests, but that is why we have research, precisely to point up those occasions where common sense is wrong. So even where teachers were given information about sickle cell disease, this did not by itself improve support to young people with sickle cell disease at school. Also, we found that many young people did not want to be picked out as different. They did not want to stand out as different from their peers. So the challenge we had was to suggest an intervention that did not depend upon teachers' knowledge and awareness of sickle cell, and that did not mark out the young person as different from the crowd. Teachers are faced with many possible different medical conditions, and it is not reasonable to expect them to remember details of all of them. They are also faced with many other sources of pressure: pupils with other learning needs, inspections and league tables, and other outside pressures. That is why so many are currently anguished and leaving or hoping to leave the teaching profession. At the same time, young people with sickle cell dislike initiatives that draw attention to them as different from their peers. What was needed was a policy that supported the student with sickle cell, but which operated in the background without overloading teachers with information. Our thought was that what was needed was to change not individual people, but to change the social environment, to change the overall culture of the school. Here are a few examples of changing the school ethos of the social ethos of the school in the background. One school had an early evening twilight catch-up session for any pupils who had missed class for any reason. This helped the child with sickle cell catch up, but without drawing attention to them as themselves as different from the others. Another all-boys school had a uniform consisting of short trousers. This meant that the boy was suffering when outside in the playground in cold weather. He wanted to wear tights to help keep his legs warm, but risked being teased and bullied if he did this. So he wanted to wear long trousers to cover the tights, but that was not school uniform. Eventually the school governors agreed to change the school uniform for all pupils to allow them to wear long trousers. This helped the boy with sickle cell, who could now wear the tights and the trousers together, giving 2 layers of protection against the cold, but who could do so without drawing attention to himself as different from the other pupils. A third example: a school had some porter cabin classrooms, large metal boxes that tend to get too hot in summer and too cold in winter. Either extreme of temperature would have caused problems for the student with sickle cell. The school used its computerized timetabling system to make sure that the class with the child with sickle cell never got timetabled into the problem classrooms. This was more effective than permitting a child to break school uniform policy by wearing coat and gloves indoors, because it only took a substitute teacher or a member of school staff not in the know about the child to start an argument with the young person with sickle cell. A fourth example: children with sickle cell often experience problems with swimming lessons. The goosebumps you sometimes get when getting out of an unheated pool would be a risk for a child with sickle cell of going into a crisis. One school had an arrangement with the local swimming baths to raise the temperature of the pool and the air whenever the class with a child with sickle cell was due to visit the swimming baths. Finally, One school instituted a system of writing in to the school records of a child which teachers had had an update on sickle cell, so that if the child with sickle cell moved to a class where the teacher had not been updated, this could be addressed. The problem with all of this is that School A did the first thing on the list, but none of the other things. School B did the second thing on the list, but not the other things. Any one individual school had maybe one good initiative, but what we wanted to encourage was schools to implement as many examples of good practice as they could in support of the young person with sickle cell. This is why we developed our Guide to Sickle Cell and School Policy that you can see illustrated in this slide. The phrases education, health and care refer to the 2014 Children and Families Act, section 100 of which places a duty on school governors or heads of academies to make arrangements for supporting pupils at the school with medical conditions. In order to change the school environment in the background, without drawing attention to individuals living with sickle cell, and without requiring teachers to be knowledgeable about sickle cell, which is after all one of the most extensive and complex conditions known to medical science, we've inserted into the guide examples of what we believe to be good practice, and we have highlighted them in green, as we can see here. This one relates to the good practice regarding school absences and twilight catch-up sessions. We also consulted sickle cell medical specialists to enable us to summarise the key emergency medical information for school, which is highlighted in this pink box, which appears within the guide. One of the ways school governors could meet their legal requirement to make arrangements for supporting pupils at the school with medical conditions is to draw up an individual education, health and care plan. A bit like a special educational needs statement, but this time for a child with a medical condition such as sickle cell. In our guide, School Policy on Sickle Cell, we have suggested an outline individual education, health and care plan, and suggested people who might be involved in drawing it up, such as the person with sickle cell, their parents, and if available, a specialist sickle cell nurse. Just to remind you that the guide is free to print, to circulate on social media, or to place on a website, so it could be made available on school, NHS Trust or community group websites if you wish. In the second part of this talk, I turn to the issue of sickle cell students at college or university. Here are some ideas to help students with sickle cell at university that we have come across. For example, our own University Disability Services took the initiative to link up with a London teaching hospital who had a very large number of sickle cell patients, and for university support staff went to attend the NHS Trust's Sickle Cell Transition Programme. The transition programme was helping teenagers get ready to move from paediatric care to adult care and from childhood to adulthood. In that way, our university support staff were able to understand more about the needs of students living with sickle cell, and in turn they were able to contribute their knowledge of university procedures to those who were running the transition programme. Some student support services are labelled disability services or perhaps disability student support. We think that calling it student support services is better because we know that many young people with sickle cell don't readily identify with the disabled identity, something we'll come back to in the employment talk shortly. On any admissions forms, we think it would be a good idea to ask specifically about sickle cell, rather than to ask about medical conditions and then perhaps give diabetes or asthma as an example. And we think it's a good idea to ask specifically about sickle cell in order to actively encourage people to disclose their sickle cell to the university. We also think it's good practice for the local NHS Sickle Cell Service and the University Student Support Services to have links to one another's services on their respective websites. The local NHS services could help by being present at the Freshers' Week and arranging the opportunity for any university students living with sickle cell to visit the ward where they would be treated, to meet some of the nursing staff who would look after them, especially the sickle cell specialist nurses, and to learn about any special local procedures. For example, there may be local procedures on how to self-refer directly to the sickle cell ward without going through the accident and emergency department. Some consultant haematologists already ensure they send a letter from themselves as the person's main sickle cell carer to date, a letter to the consultant haematologist in the university town where the student will be studying, so that the receiving service knows about a possible sickle cell patient. Above all, it's a good idea to declare yourself to the student support services, because they may be able to help a student with sickle cell secure reasonable adjustments to support their learning. This might include, for example, arrangements to have a note taker attend lectures with you, have extra time to complete exams, or to have recordings of lectures available to compensate for any lectures that may have been missed. We've also come across some examples of what we would regard as bad practice. One university tutor refused a student with sickle cell an extension on coursework because they said that sickle cell was a, quote, long-term condition, not realising that, of course, sickle cell is a long-term condition, but also can show itself as an acute illness, as in a sickle cell crisis. Another tutor caused emotional upset, which, as we know, is itself a possible trigger to sickle cell crisis. And they caused upset by being inflexible about a rule of not letting students enter lectures late, not understanding how being anemic and tired can impact on a person with sickle cell. One student who was very severely affected by her sickle cell took many extensions and deferments of work for modules, and in the end exited the university after 3 years, but with the usual amount of £50,000 of student debt, but with only her year 1 certificate level modules completed. This is where only government policy can really make a difference. What is needed here is for courses to be offered part-time as well as full-time, and for the fee and loan system to be capped at the price of a 3-year full-time degree, irrespective of how many years the part-time study is spread out over. Universities also need to recognise the implications of ending the registration of a student with sickle cell disease. One student we know had their studies ended by a London university, but not only did this mean that they lost their university place, they lost their only source of housing, the student halls of residence. They lost their only source of income, the student grant, and their parents could not afford to take them in. The person then had to move 200 miles north to a city, town they knew no one in, just in order to be able to afford to rent somewhere. We also have heard of examples of good practice. One university had student housing on their Greenfield campus site for year 1 students only. Year 2 and year 3 students were expected to find rented accommodation in the nearby town. But this university allowed the student with sickle cell to stay on campus, exceptionally to stay on campus in years 2 and 3. Not only that, but they allowed her to nominate a friend who would stay in the same accommodation block as she was in. They also briefed university security staff that if an ambulance was called to her sickle cell crisis, then the security staff should meet the ambulance at the university entrance and guide them to the block where the student with sickle cell was living, because the student blocks all look very similar, and it would be very easy for ambulance staff to spend many precious minutes trying to find the right block and the right housing. This is important because a student of that same university died in 2011 when a landlady in private rented accommodation did not understand sickle cell, and the ambulance refused to take the student to hospital, and sadly she died. Many universities have a system of filling out forms to apply for extension to coursework deadlines. If a student with sickle cell is ill, they are likely to be tired, in pain, and just at that moment they may be unable to complete extension application forms. One university support service agreed that they would undertake this form filling on behalf of the student with sickle cell if the sickle cell student briefly contacted them when they were ill. We know that getting a good degree, often regarded as getting a 2-1 or above, is seen by many students as a key to getting a good job afterwards. This leads us to the third and final part of the talk on sickle cell work and employment. This is because one of the things people told us about work was if only they'd had a bit better support at school, or a bit better support at college, or a bit better support at university, then they would have had better qualifications and been able to get a better job. So we now come to the third and final part of the talk on sickle cell work and employment. The sickle cell work and employment research was conducted between 2018 and 2019 with our sickle cell partners, including the Sickle Cell Society and Oscar Sanwell from the West Midlands. We interviewed 47 adults living with sickle cell about their experiences in work and employment. The first point to note is that work is more than just paid employment. People with sickle cell disorder carry out all sorts of unpaid work. For example, many were unpaid carers for children, unpaid carers for older people, or even unpaid carers for other community members. All also had to work hard in their own self-care. Living with sickle cell disease itself is very hard work. The adults with sickle cell carried out household work. In some cases, the man with the sickle cell became the domestic home worker and the woman carried out paid employment. People with sickle cell also did enormous amounts of unpaid but extremely socially useful voluntary work. For example, 30 years running the Sunday School Club, 20 years as an unpaid community youth worker with inner city kids, 20 years as a school governor, to give just two of many, many examples from our study. People with sickle cell also did a great deal of work for support and community groups, and not just for sickle cell groups, for other charities as well. Finally, people with sickle cell developed a different type of reliability. Employers usually look for the worker to be there, just to physically be there. People with sickle cell were reliable in a different way. They would be there whenever they could, that is, whenever they were not ill themselves. We have already mentioned just how hard it is to self-care with sickle cell. People often ask, are you living to work or working to live? For those living with sickle cell disease, they are working to work. They are having to work so hard just to remain well enough to go out to work. Many of our interviewees stressed how strong their work ethic was. They said, for example, that they were never criticised for the quality of their work, only for their illness absences. They even worked when they were in pain, worked when using painkillers to get by, worked when they were extremely tired, and even worked from laptops when they were hospitalised. One of our respondents actually got out of her hospital bed and went to attend a job interview for a job which she actually got before coming back to the hospital bed to complete her treatment. The adults with sickle cell, their commitment to work was so strong that they used annual leave to cover for periods of illness or for regular hospital appointments. People with sickle cell disease also had to live very restricted lives socially in order to remain well enough to go to work. For example, they had to avoid after-work drinks, both to avoid the alcohol itself and to avoid staying out later and getting tired. Holidays were often ruined by illness. One man was abroad seeing his brother for the first time in 20 years. They sat at the harbour at sunset, and he says he took one sip of beer, just one neck of a bottle of Heineken, and it triggered a crisis, ruining the holiday and ruining the family reunion. And there are many accounts of either holidays or family reunions or parties ruined by illness. The people with sickle cell were so committed to work that they often forced themselves to return to work too early, but this just resulted in them becoming ill again. To sum up, people with sickle cell have to drastically restrict their social lives just in order to remain well for work. They're not living to work, nor are they working to live. They are working to work. Now, our research partners wanted us not just to list all the problems that were thrown up by the research, but to point up some possible solutions. So the next few slides are divided into the challenge, the problem, if you like, in the left-hand column, and some possible ideas to try and address the challenge in the right-hand column. Now, with the best will in the world, even with good medical care and good self-care, some people with sickle cell at the more severe end of the illness spectrum are so ill that it is unlikely that they could undertake paid work at all. In view of this, we worked with a welfare rights advisor from the South East London Sickle Cell Centre, and he kindly shared with us his notes on how to complete the personal independent payments application forms. Also, one of his clients, a person with sickle cell, kindly allowed us to share her actual form, which we have anonymised. And these can be viewed to help guide you in benefits applications on our project website, sicklecellwork.dmu.ac.uk. Of course, this is a challenge that can only really be addressed long term by government policy. One thing to look out for in the news are policy discussions about something called universal basic income. The idea that all citizens would be entitled to a basic income without meaning testing or assessments. Based on the amount of time off through illness as the person with sickle cell moves into middle age, we think the government should consider underwriting 25% of any employer's wages to make it easier for employers to take on a person with sickle cell. Next, there is the difficult issue of if and when to disclose to your employer that you have sickle cell disorder. The advice we've been given by an employment lawyer is to declare your sickle cell to your employer, simply because if you don't and they find out, then there is absolute legal clarity that the employer can legitimately dismiss you. And sadly, this did happen to two of our respondents who were worried about disclosing sickle cell, but then when it became apparent, they were then dismissed for not having declared it. The advice from a lawyer was that the best time to declare was at the point when you have been given a written offer of the job. There remain, though, a lot of difficult areas. Not all jobs have a written job offer and may just rely on handing in a CV. And although it is not legal to ask about a disability or long-term condition on an application form or during a job interview, some employers will do this, and clearly many people seeking a job will feel reluctant to challenge an employer if they do this, because it feels they mean they won't then get the job. Then there is the employer's knowledge of sickle cell. What does the employer know about sickle cell? They may have heard the term sickle cell, but may not know all the complicated symptoms of sickle cell that might be involved. In one instance, a person got a good job with a media company in London and then told them that she had sickle cell. It was only after starting and the HR department had gone away and looked up what sickle cell meant that the employer became difficult and often offered the person with sickle cell money to go away and not be employed by them. Next, we have an instance where a lawyer for the employer has ridiculed the person with sickle cell because the person with sickle cell did not know all the symptoms that might develop as they got older. But this is putting too much onto the person with sickle cell. Sickle cell is one of the most complicated conditions known to medical science, with dozens of possible symptoms affecting all parts of the body. It is simply not possible for a person to know in advance what all these are. And it's also not necessarily desirable to reduce the self-esteem of a young adult with sickle cell by listing all the possible symptoms that might develop as they get older. A major difficult issue is the very term disabled. We know that many people with sickle cell actively dislike the label disabled, not least because there are already many negative labels attached to black people by racists. However, our suggestion is to try and put aside this concern about negative labels, because in terms of accessing practical help, a great many resources lie behind the door marked disabled at the moment, people with sickle cell are being denied these resources. The legal advice given to us is that although the diagnosis sickle cell does not automatically trigger acceptance to the disabled identity, in fact, when you look at the legal definition, which involves, quotes, a substantial and long-term adverse effect, unquote, then it becomes clear that, in practice, 99.9% of those living with sickle cell meet the criteria for the legal definition of disabled. One resource that this opens up is that if you are living or working in London, then the Disability Law Service can offer free advice on employment issues, and in some cases may even be able to represent you at a straightforward employment tribunal. One of the other main challenges at work was the working environment. This might be the workstation being too cold or too hot, or being assigned to unsuitable jobs, for example, stack chillers and freezers in the supermarket. Again, this is where the disabled label comes into its own, as you could apply to the government's Access to Work scheme, which is a fund the employer can draw upon to enable them to employ someone. This might be a special heater, or it might be money to pay for a taxi to work when the weather is bad. On our project website, you will also find a document called A to Z of sickle cell symptoms and reasonable adjustments, which will give you some ideas about what reasonable adjustments to the workplace you could request from an employer. We suggest that this document is for people with sickle cell only, not the employer, so that it does not become a weapon used against people with sickle cell. We've also developed a guide to sickle cell work and employment, and in that document, what we regard as examples of good practice are highlighted in blue. We will see further examples of these in the slides that follow. One frequent issue for workers with sickle cell is travel to work, the commute. Travel to work by public transport means tiring journeys, exposure to cold and bad weather, waiting for buses and trains, and even before the added risk of COVID-19, the commute meant exposure to other commuters with colds and infections in confined spaces. We feel that employers should suspend any green travel policies and permit those who have cars to use them for travel to work. This means guaranteed car parking spaces near to work as well. If this can be combined with flexible working hours, this would also mean that the commute could be undertaken outside of rush hour, and the person may have a shorter commute and be less tired as a result. In London, you can ask the Transport for London for one of their blue badges, which would hopefully enable you to be offered a seat on tubes and buses. And you can also apply to have the congestion shaft waived if you look at that address on the Transport for London website. Of course, the main issue we keep coming back to is the one of illness absence from work. Based on our respondents, those in full-time work might end up missing, say, around 20% of work time overall. One thing we need to challenge unequivocally is the HR return to work interview, where any illness absence triggers a meeting with a line manager and where several absences trigger further policies. We need to let HR departments know that such practices are discriminatory and need to be suspended for people with sickle cell. In applying for jobs, you might also look out for employers who badge themselves as, quotes, disability confident employers, as these are employers who are supposed to have taken measures to be particularly accessible to disabled workers. One further challenge is the great variability of sickle cell, both between different people with sickle cell and within the same person over time. In our Guide to Sickle Cell and Employment, we suggest a workers' individual support plan, which can be adjusted to reflect the particular needs of the individual worker with sickle cell. A workers' individual support plan can set out our agreed reasonable adjustments to working conditions at the outset of employment, but can be regularly revisited to take account of any changing medical needs over time. Part of the workers' individual support plan could be to get the employer to recognise the variable experience of pain and the spectrum of possible responses. So in this diagram with the arrow, we're suggesting that the mildest pain might possibly be dealt with the person with sickle cell themselves, staying at their own workstation, and self-medicating or using individual distraction techniques. Slightly more pain might require the person to take such medication, use their individual techniques, but also perhaps they would benefit from some time out, a chance to use a safe space to lie down and rest for a couple of hours before returning to work. A little more pain, the next level up, might mean that the person needs to go home and rest. In that way, they might be able to return to work quickly, whereas continuing to work might trigger a severe crisis and being off for 2 to 3 weeks. More severe pain might mean the person needs to go home and manage their own referral to their healthcare provider, and the most excruciating pain might mean dialing 999 for an ambulance. But it's important to recognise that the employee is an expert in their own pain, and only the employee can say how severe their pain is at any given time. The employer always needs to listen to the worker in that respect. As someone with sickle cell, you have at least 2 of what are called in law protected characteristics under the 2010 Equality Act. And these protected characteristics are those of race and disability. Gender would be another protected characteristic. This should, in theory, give you legal protection under the Equality Act and also under human rights legislation. We also strongly recommend joining a trades union. Further advice on your legal rights at work can be found on the Disability Rights website, and they run a right to participate and take action around employment guide, which is on their website. We've put a number of these ideas and suggestions together to make our guide to sickle cell work and employment. This is available as a PDF on our website, sicklecellwork.dmu.ac.uk. The guide is free to print, free to circulate on social media, and free to upload if you have your own individual website. That is the end of the presentation. On this slide there are the contact details of myself and my colleague Dr. Maria Bergs, together with the link to the Employment Project website, which I'll read just one more time: sicklecellwork.dmu.ac.uk. Thank you for listening.
Okay, well, that was great to speak before, and I'm always impressed with what he's got to say, especially with like schools and so forth. Leanne, can you hear me?
Yes, I can hear you. We do have Professor Simon on the call also.
Oh,
So
brilliant.
if there are any questions or any comments, we can take those now.
Okay, so does anybody have any questions, or are we saying that this was completely, understandable? Everybody got all the information they needed? Everybody can unmute themselves. You can unmute yourself if you need to speak.
We've got a comment from Mr. Phil here saying very interesting and informative video. No questions for now.
And a further comment hello?
Hello, Mr. Phil, can you repeat what you were saying, because your voice was a bit funny, and then I know that Carol will want to speak after you.
Okay, no problem. Can you hear me now?
Yes.
Okay. I just wanted to say it was actually a very interesting presentation, and it's encouraging to hear the work that has been done by sickle cell work. As someone that is a friend of a warrior, it's encouraging again to really see how much they've done, and just to encourage them to keep going. We need every help we can get.
Thank you, Mr. Phil. Your voice keeps cracking up, but we did understand what you said. Much appreciated.
Just Samantha, Kwasi, can I ask Simon, has he been able to implement any of these findings into the schools, and has it gone to the education board for them to look into it?
Yeah, one of the problems that, I mean, we did the schools research in years ago was the fact that schools have, over the last 20 or more years, they've kind of developed a system where they're a law unto themselves. Each individual school makes their decisions, or each individual academy makes their decisions. What would have been very useful was to have the old-fashioned local education authorities, because then we could have said to, for example, Haringey LEA, please need to do something about Southwark and so on. But the problem is that in order to make the difference now, we almost have to go around each and every individual school, and of course that's not something we have anything like the resources to do. The Sickle Cell Society did back in, I think, 2016. We had a little bit of money, and we spent some time putting together all the schools, and we all a copy of the school policy. Out of 1,000 or so schools, we had, I think, 2 replies of any interest. So it's very frustrating. I mean, I could only suggest that there's been a relatively recent general election. See who your new member of parliament is. Maybe send them a copy of the guide and ask them what they're going to do in relation to improving support for children with sickle cell disease in schools, because as the young people told us themselves, and as the adults tell us, it's really important to get the best possible education, because that opens up the possibility that you might have a type of job where you might be in an office using a computer, which, as the recent COVID-19 problems have shown, it's much easier to hang on to a job if you're able to do your job from home. If you're having to go into work, you're putting your own health at risk. So for all kinds of reasons, for someone with sickle cell, it's very important to get the best education. So I can only suggest a campaign through your MP.
Like it has to come from the top, the Department of Education. It's got to come right from the top, and it's got to go to them to stream out to the schools.
Yeah, I mean, it's not actually for want of trying. I mean, I don't know if you've heard of a new MP called Florence Eshimoli, and she's someone who is now the MP, I think, for Vauxhall in South London. And back she was a member of the Greater London Assembly. John Baker, CEO of the Sickle Cell Society, and I went to meet her to try to get the Mayor of London to take some kind of action around sickle cell in schools. And we only had a very minimal response. They agreed to put the guide onto their Healthy Schools website, but that was a long way short of what we were hoping for. We were hoping that they would fund some workshops so that every school could send at least one teacher to get an update on sickle cell. So in various ways, you have to engage, but it's, there's many different competing demands on policymakers' times, and all I can say is that we've done our best, but we've not been as successful as we would like to have been. And I think it takes everyone to engage with their own MP and write to their MP and write to their local, maybe their Greater London Assembly representative, and write to them out, try to take sickle cell in schools more seriously. I mean, maybe that's something that Tottenham Group could try to do as a group, so that several people, it's not just coming from one person, it's coming from several people.
Yeah, very, very good report though, very good.
Thank you. Any other questions?
Yes, hi, can you hear me? The virtual hand is not working. I tried to raise my hand in the virtual box, but somehow I wasn't able to. But I wanted to first thank Professor Dyson for your wonderful report. My question is regarding, like the previous lady asked about the education system in schools. I wanted to find out if you all have approached the local education authority, and if not, perhaps move on to the governing bodies of schools, because I know that there are opportunities for persons like yourself to actually present. I'm a governor, I'm a school governor at a secondary school, and I know I have never heard anything about sickle cell within our school. So I'm wondering if there is any way we can get your team and your people to actually present at their local education authority, or have children included in the special educational needs and disability. Because I know that some schools, you know, children, the majority who are on pupil premium or special educational needs and disabilities, they have extra support, provided that the child has has a statement. So I'm wondering, what are your thoughts with regards to that?
Yeah, so I do apologise. I only got about half of that because the line was cracking up. But I did hear about school governors, and one of the things that you'll recall from the school's presentation is that the lead to make sure that have the extra support we need does fall onto school governors. So school governors, you're right, are a very important potential audience, because it is up to them to make sure that some systems are in place. And the obvious way to to put something in place is to at least offer the possibility that the young person with sickle cell has the individual health plan. Unfortunately, my understanding is that parent education need has attached to it a pot of money, albeit a very small and decreasing pot of money. If that's not the case, that schools get any particular extra pot of money to help them support children with medical conditions such as sickle cell. So again, that's a kind of, that's a political issue. You need to press at a higher level to get that. Regardless of speaking to governors, it's.
I'm not sure, Professor. I couldn't hear.
Situation. I'm happy to share, and I have shared just again this morning with Samantha, the link to this lecture, so that you could always play the first 15 minutes or so of the lecture to a school governor meeting. So if you email Samantha the lecture, free to use that link to click on and play it for school governors. And there is also a longer version of a lecture which only focuses on schools. And I can share that as well if people would like. If the situation with COVID changes, then myself and my team, we do go out and give talks, but that partly depends on whether one of two things, whether we have trials, and unfortunately they had done that for the first 6 months of this year. They'd given us a small pot of money, and we've got about 10 talks variously to not only to yourselves in Tottenham, but to places as far apart as Liverpool and Manchester and so on. But unfortunately, COVID is on its way to apply again, so you can get that money again. I'm not overly hopeful, because universities will be under tremendous pressure, having lost pretty much millions of pounds of funding, because we're not now going to get the overseas students that would have come into universities. Or if a particular group is willing to themselves to reimburse a train fare, then that would be possible.
Okay. Hello. Let me see. Yeah, my mic is unmuted.
And a note lecture, when COVID is hopefully over and maybe there's a vaccine or something, then we can speak again about coming in person.
Yes, Professor, I wasn't able to hear everything you were saying, and I'm wondering if another time, because your line is breaking, there's quite a lot of static in the line. So perhaps, Samantha, I'm more than happy to make myself available at some point for us to have a conversation with regards to education, because Professor, I'm actively involved in the education in the borough that I live, and I'm a representative for residents throughout the borough with regards to education. I sit on practically all of the education panels. So I'm more than happy to pick up a conversation at another day to see how we can, to get more clarity and information with regards to, you know, your presentation around schools and stuff like that, and how we can advocate to get, you know, support for sickle cell children in school.
Right. Yeah, so probably the best way to contact that group it was on the end of the lecture, but also Samantha has my email, so please do get in contact by email. Is probably the best way.
Okay, thank you so much.
Great. We have a comment here from Hilda saying, thanks a lot, very informative presentation. I'm surely going to forward to a friend's school that has failed to support her daughter. So that's great. That's really what we need. We need as much individuals as possible using the documents and putting them forward and taking them to places of power so that the voice of the document can be heard. Any other questions or comments?
Yeah, I'd like to say something. Having received Professor Simon's definitely trying to get them in schools and in the workplace, but we, like, our catchment area is like Harringay, Enfield, Barnet, and Enfield, you know, and that's a large area, and we're a small group. So it's been quite difficult to get access to all of these schools and everything. But now with the e-copy, which I did email to everybody that pre-registered on this meeting, you know, it's easier to get them, as I said in meeting, with regards to my own personal issues at school, you know, and how Professor Simon explained, like, the issues that children still nowadays, the issues that they're facing, you know, at school is traumatizing. It's, you know, it's horrible. You know, but if people are educated to sickle cell, and these guides are set to educate, you know, so just please, like, just share them, share your e-copies, and if you want hard copies, please contact Sickle Cell Cause. We still have some left, you know. Obviously it's expensive for reprinting, so the e-copies are better to get all over the place, but we do still have some hard copies left, you know, so please contact us for that.
I can always send you another box of the school ones. Just as soon as the campus opens up again.
Great.
That's great. Thank you, Simon.
Perfect. We do have a question here from Supreme. He's asking, Professor, is sickle cell classed as a disease or condition or disability?
Well, that's an interesting question, because I'd say that one of the difficult things about sickle cell is that sometimes it's like sometimes like long, and sometimes it's like a disability, and sometimes it's like all three at once. And that's where I think people have difficulty getting their heads around it, because it's so complicated. But the point I was making, particularly in the employment part of the lecture, was that although I fully understand why people may not feel very comfortable at all with the disability label, it is at the moment the only leverage to actually get either access to funds, the government's access to work funds, which, as I explained, obviously helping these customers. It might be getting an extra modification to a uniform, it might be getting a heater in place or whatever. But it's only by going through that access to work for people with disabilities that would open up. And so in a sense, what I'm saying is I'm encouraging people to put aside the concern about the label, just kind of use it to get access to the support that's needed. But it's a good question, because I think that the problem with, or the challenge of sickle cell is that it's a it's an acute illness, it's a long-term condition, and it can be a disability, and it kind of, you know, in some people it's all three. So that's what makes it very challenging to not only to live with, but for policymakers to understand how best to respond to it. Yeah, absolutely. Yeah, unfortunately, it doesn't fit into a tiny little box. No, that's right. Okay. Any other questions?
I know Maria raised her hand.
Hello everyone. Hello Samantha. Hello Professor Dyson.
Hi Maria.
I just want to state, because I was part of the people who took part in Professor Dyson's report with regards to employment. So I know that somebody did ask with implementation with education. What about our main government sectors? Because with this so-called issue going on at the moment with Black Lives Matter, I worked for the Metropolitan Police for 15 years. And I can actually state that I was pushed out of my job because of my condition. So I just think that with regards to what is going on at the moment, those are the main governmental areas that should be targeted with being Black and being sickle cell. So has the professor done anything with regards to meeting with the major employers of the country?
Well, not with regard to meeting with the employers, because the project finished in February of this year, February 2020, and that was just the point at which Maria and myself were going to start to try and do the impact work, trying to get the guide noticed and taken notice of by policymakers. So we've been, some of you, Samantha, I know, was there at the what's called the All-Party Parliamentary Group, which is a special interest group of MPs who have a particular interest in sickle cell, and we presented the employment guide to them in, I think it was the end of October 2019, and unfortunately the chair of that committee, who's an MP who represents one of the Wolverhampton seats, unfortunately the general election means that committee has to disband and get reformed, and with everything that's happened, as far as I know, it's not yet reformed. So because the chair of that committee had agreed to send copies of the employment guide with a House of Commons headed note paper to some key organisations. We were due as well. We went to the national black sections of the Trade Union Congress and gave a presentation there, and we had a couple of bookings to go and speak to the RMT union, the Transport Union, and Unite, one of the other large unions, to their national conferences. But again, unfortunately, both of those were scheduled in March and April and were cancelled. So again, as soon as things open up from COVID, then we'll be trying to start that impact work again. But it is a long and hard road, and I recognise, Mariama, that you gave us the information about the Metropolitan Police. That's where the organisation I pointed to in one of the slides, the Disability Law Service, might have been of use, because I know that it can cost a lot of money to try and take your employer to an employment tribunal. And had you known about the Disability Law Service, at least that would have been, at least initially, free legal advice on what to go about things, how to prepare for an employment tribunal, and so on. So if you do hear of anyone in a similar situation of unfair dismissal, then at least try as a first port of call the Disability Law Service, because that service is free and you won't be adding to your problems by running up a large legal bill, by using them. So that would be the first port of call. But I think a lot of it comes back to campaigning through your elected representatives, whether that's members of Parliament, whether that's members of the Greater London Assembly, so that you can put pressure on the Mayor of London, or whether that's through your local councillors, so you can try and look at local borough services in terms of, you know, as you say, Haringey, Enfield in the case of Tottenham.
Right. Thanks, Professor. Well, in my case, I was actually fully aware of the legal help that is out there. But as we stated, with regards to financial aspect, it's a tough situation, because I had to actually fight 3 tribunals on my own because of one, whether there's the racism, whether there's the disability discrimination, and the unions are there. But when it comes down to boiling point, they're not there to support you, because these are the same people that they drink with, they hang out with. So your case becomes, non-important. So it got to a point whereby when I stated 15 years of service, 15 years of hard work, 15 years of popping pills, sitting at my desk, and having to deal with 3 tribunals on my own. Even one of them I actually paid, whereby they messed up the case and I had to go further with that. But the others I actually dealt by myself. And it's a tough situation. This is why most people, their livelihood is taken away from them. The racism factor is a major aspect, whereby, for over 40 years or so, we've been trying for sickle cell to be recognized in the country, which I think is a little better. We've gone further, but much more needs to be done, because some people are losing jobs for no reason.
One more person who we hope we made a difference with, and that is that there's an organisation, and without my files back at the university, I can't remember the name of the organisation, but they're an organisation that campaigns for everybody to have access to justice and the legal system. And they'd produced a kind of booklet, which was a guide for judges and for magistrates and people who sit on kind of legal and tribunals in judgment. And it was a guide to say, when you're dealing with a person who has this particular condition, you need to take account of. So we were able to advise this lawyer who was doing this handbook of advice for judges and for tribunal magistrates. We were able to kind of add some things about sickle cell. For example, they hadn't got anything about sickle cell leading to particular fatigue and tiredness, so that being able to concentrate over several days of a tribunal might be a challenge. And they hadn't got any recognition that being emotionally upset and stressed by actually going through a tribunal was itself an issue. So we were able to add our information to that person who was drawing up a handbook for, as I say, for judges and for on tribunals. So, but do bear in mind, there's only myself and my colleague Maria who are kind of working with this, on part of what we have in addition to doing our lectures and administration at the university. So I think it seems to me that the best way forward lies in everybody trying to engage with their elected representatives, so that we can change some of the laws and regulations that are getting in the way of either best support at school or best support in employment for people with sickle cell.
Yeah, well, thank you so much, Professor. And we do appreciate all the hard work that you and Marie have actually put into supporting this cause. And thanks again, Samantha and the team, for putting this together.
Right. I think we've got time for one more question. I think someone had their hand raised, but before we take that question, I'll just read another comment or question from Supreme. He's asking, has the professor heard of Ward Profile, which has a, sorry, bear with me one moment. Yeah, Ward Profile, which has a data.
Can you start again, Leanne? Sorry, Leanne, can you start the question again, because it went funny?
Yes, so I was asking, the question is, has Professor heard of Ward Profile, which has data concerning issues with health? Supreme says, from his research, showed the highest sickle cell in Barking and second Hackney, Homerton specifically, Homerton part of the borough.
Right. Yeah, I've not heard of ward profile, but if you're looking for statistics, then there's something called the National Hemoglobinopathy Register. Now, that's something that many folk with sickle cell will know about because they will have been asked by their hematologist if they agree for their name to go onto this register to help with medical research. But and if you just bear with me, I'm going to Google while we're speaking. I'm going to Google it so I can give you the URL. But it, as well as a part of the register that's only available to accredited doctors for their research, there is a publicly accessible part where you can look at clinics, and that may be useful if you're, for example, if you're writing to an MP in Hackney, for example, and you want to say, well, there are 600-700 people attending the Homerton who have sickle cell. The email address is http://nhr.mdsas.com. I'll copy that to Samantha as well. But that hemoglobinopathy register has an annual report, and the annual report will give you a list of how many sickle cell patients there are attached to each hospital clinic, both in London and outside London. The only thing I'd say is that it's a slight underestimate of the numbers because not everybody agrees to be on the register. So
right.
it slightly underestimates the numbers. But that might be useful information to say, well, look, for example, my child's having problems in school, but did you know that there are so many hundred children with sickle cell in this part of London, for example? That may be helpful when you're writing to an MP or to a member of the Greater London Assembly or whatever.
Perfect. Okay, so we're going to take one last question. Someone had their hand raised. So if you'd like to unmute yourself and ask that question now. No. Okay, I think that might be it for the questions and comments.
Can I just say that if there's anyone who's missed out on questions or comments, I'm happy to answer them by email if they're passed through to me. I'll pick them up at the beginning of next week and try and reply to them.
Oh, perfect. That'll be great. Okay, thank you very much, Professor. I think everybody agrees that was very informative, very helpful, and a tangible document that we can all use if we have not already started doing that. It's something that we can all start putting into action and using for our betterment to advocate the needs that we have in these areas. So thank you very much for your time.
You're welcome.
And we'll definitely forward you any additional questions.
Okay.
Thank you. Thank you, Professor.
Okay, thank you. Bye-bye.
Bye for now. Bye-bye.
Okay, guys, so I'm glad you guys enjoyed that. The information is powerful. I will make sure that everybody on this in this meeting has copies, and also the voice copy, so that you can, as he said, give it to school governors and so forth. We can make a difference, if we work together. Okay, next up, we've got like to welcome Daniel Gunn to come back by popular demand for Daniel to return, and he said yes, he'll come back. So happy to have him back, for recognizing Sickle Cell Awareness Day, even though it's the day after. So Daniel, my fellow sickle cell warrior, but also a registered integrative counselor and psychotherapist, something that I'm not. Please unmute yourself and take it away. Okay, Daniel, let me see if I can find you in the chat.
Can you hear me?
Yep, can hear you now, Daniel.
Okay. I was having some problems with the audio a while ago. Good. Let me just share my screen. I thank you for having me back. Good afternoon to all. And I'm dialing in again from the Bavarian countryside, Germany. I may be back in the UK first week in July if there are any flights going at all. And if I'm allowed to come out.
Yeah. Can you speak up a bit, please?
Yeah, can you hear? Oh, yeah. Can you hear me? It's much better. Is it much better?
Yeah, that's better. Yeah.
Okay. Okay. I said thank you for having me back. It was good to listen to Dr. Dyson with all this complicated stuff. I have a court case going on with my ex-employer, tribunal over this situation. But you know, everyone is different because I worked 12 years without calling sick one day.
Yeah.
The first time I got sick and was on the job, not even with my sickle cell problem, but I drank something from the vending machines that gave me a stomach upset because I have chronic, stomach problems as well. It's complicated. All right. And they tried to push me out.
Yeah, because they caused it. They're trying to deny that they caused it, so they get rid of you.
It's been going on for 2 years now. I heard the sister who talked about being in the police force and all that, and I could relate to that. But I'm good. I've done my homework. I have the Disability Law Service behind me in the background. Okay, in the background. They don't support just anybody. They look at the cases to see whether they're going to win or not because they also get funding from the government. So I have them in the background, and we've had our first preliminary hearing, and so it's ongoing. It's an ongoing thing. So it's not easy, but you have to be strong if you find yourself in that situation. The sickle cell it's a disease, but because it's uncurable, it makes it a condition.
Yeah.
And if you have something else in addition, like me, who had a road traffic accident for 38 years ago with, traumatized spine, from neck to bottom. And then there's a degenerative disease going on as well, wear and tear on the spine. Obviously, you're disabled because the way it affects you daily, your daily life activities is not that easy. It's not something that someone can imagine because you don't have control over.
That's right.
Over what's happening. So it's a very complicated issue, but despite that, we have to stay strong. We have to stay strong and be on top of it. Good. Last week, for the benefit of those who did not sign or check in last week or register, be with us last week, couldn't be with us last week. We looked at how to coping with trauma in the window of tolerance. This is a little bit of work from a piece of work from Dr. Daniel Sickle, a child psychologist who created this window of tolerance, for us to gauge where we are really, so to be able to help to manage stress and manage trauma and all that. But today, I'm going to share another piece of work from, let me share my screen. I'm going to share another piece of work from Dr. Emiliano Simon Thomas, PhD. It's on neuroscience of resilience through compassion. And I think lately a lot of people have been talking about compassion. And compassion is something that we say, I think the Caribbean, in the Caribbean, they say who feels it knows it.
That's right.
So if you can feel for your neighbor, then you can sort of, imagine what your neighbor is going through, and supporting whatever way possible, or whichever way possible. You know, so compassion is being talked about a lot in the psychology realm, and also resilience. You know, we're all different. Some of us are very resilient and some of us are not. But actually, on the whole, on the trajectory, human beings are very resilient. You know, so it's unfortunate that some of us are and some of us are not that resilient. So we'll look at that. We'll look at the underlying issue of that. And I think it's stress. Stress is a major thing that we all go through. And if we can, I believe we can manage stress, just the normal stress, if we can manage that, then obviously we will be able to also deal with our typical highs and lows and challenges and threats that we encounter day in, day out. Now, to start a conversation about resilience, we have to think about stress. We can define stress as that feeling we have when the demands in front of us outweigh our resources or our sense of being able to do what we aspire to do in a way that we would like to do it. Think about our busy daily lives, as I mentioned earlier, daily lives with self alone, with ourselves alone, and then to add on family, work, and other relationships. So on daily basis, we really have a lot to deal with as human beings. Now, no conversation or discussion about stress would be complete without a quick survey into the human nervous system, and in particular, the branches of the nervous system that are most implicated in stress and also resilience. The two main branches of the nervous system, namely the sympathetic nervous system branch and the parasympathetic nervous system branch, are the two main branches of the nervous system. The sympathetic nervous system is often affectionately referred to as the fight or flight system. This is because activation of the sympathetic nervous system actually arouses the body. It gets us ready to respond to threats or challenges. With the parasympathetic nervous system, it's also affectionately referred to as the rest or digestive system, and works in reciprocal to the sympathetic nervous system. And what it does is slow the body back down. And it keeps us in a state of calm, help us do kind of ongoing sustenance processes like digestion, growth, and sleep. So it's interesting to see how these two branches of the nervous system work. The SNS, the sympathetic nervous system, that prepares us for threats, whether to take flight or stand and fight. And the parasympathetic system works in the opposite direction in terms of calming us down after we've encountered threats or adversities or challenges. Essentially, the sympathetic nervous system and the parasympathetic nervous systems are constantly working with one another to support our dynamic lived experience. When we are under stress, the sympathetic nervous system activates what we call the hypothalamic pituitary axis, primarily, which then releases hormones into the bloodstream. The typical hormones, adrenaline, cortisol. And what these hormones do is, again, speed us up. They get us ready to manage threats and sources of harm that we might face day in and day out. They help us act in ways to preserve our bodily integrity. They speed our heart rate, increase our blood pressure, shut blood out to big muscles, quite non-essential in the moment activities like digestion and growth, dilate the bronchial pathways to enable more oxygen to drive our immediate motor responses. So that is our quick knowledge into the biology of stress. Now look at the conceptual states of resilience. According to the American Psychological Association, resilience is a process of adapting well in the face of adversity, trauma, tragedy, threats, and even significant sources of stress. One of the pioneers and researchers on stress, George Bonanno, also has a different way of describing what resilience is. George Bonanno has worked with people who have encountered stressful events or potentially traumatic events and examine how they respond. Are all people, or are we all in general, or people in general, typically resilient? In other words, we tend to manage stress in a transient way, that is, respond actively but recover. Do we have a kind of brief moment of impairment or disruption, or our typical behaviors and functions followed by again recovery and ability to then function normally? That's the overall trajectory tends to end up being relatively stable and healthy in the face of stress. And it turns out most people actually do have a healthy capacity for resilience. Now, we're also equipped as humans and provided with a quality, again, biologically, with systems that help us manage that stress response fairly quickly so that our bodies don't return sort of enduring over-energized state. That is important when we really are facing any kind of threat. Now, let's look at the feedback loop, how this feedback loop really happens. There's a key structure in the parasympathetic nervous system that plays a huge role called the vagus nerve. What the vagus nerve do, or what does it do? It sends processes to all over the body to differentiate organs and essentially quiets the stress response. It countervails that activation with either a signal back to the brain that says, hey, there's enough cortisol in the blood right now. There's enough adrenaline. You don't need any more. And furthermore, the stressor has passed. We don't need it, so stop releasing it. Now, let's slow everything back down and get back to our kind of mode of existence that is calm and resilient or recovered. So actually, these two systems help us to actually regulate ourselves. There's one that prepares us to manage threats and stress outside, and the other is a reverse action to bring us back to normal. But it's interesting to know also that when people like people with PTSD or CPTSD, that's a complex post-traumatic stress, they find it difficult to really go back to normal. People who have really been traumatized have difficulty go back to normal. But those who haven't, I believe, when we encounter threats, we're able to recover from that and go back to normal. One of the key places that the vagus nerve has its influence that is of interest to researchers, it's its influence on the heart. So all the time, every minute that we are sitting, walking, playing, eating, our vagus nerve is turning our heart rate down when we are exhaling. So when we inhale, our sympathetic nervous system speeds up our heart rate. And why? Well, we have to breathe. We need oxygen. That is basic life right there. When we exhale, our heart rate slows down. We don't need such an energized relationship with exhaling carbon dioxide and the other combination of substances that our body does not need in that moment. And it is the dynamic relationship of speeding up when inhaling and slowing down when exhaling that represents this interplay between the sympathetic nervous system and the parasympathetic nervous system. And scientists can actually measure how strongly the vagus nerve is influencing that. So if you are a person who slow down a lot during your exhale compared to the speed of your heartbeat during your inhale, you would be considered as someone who would have what we call high vagal tone. If you're a person that has vagal tone, you tend to be more resilient. You get through difficulties more gracefully, quickly, and efficiently. You tend to describe yourself as experiencing calm states more often. You are cardiovascularly more healthy. Your blood pressure is lower. You tend to have a stronger immune response in the appropriate times. In general, you have an easier time interacting with others socially. You get along with others. People find you more socially appealing. So there are all these advantages to having a strong vagus nerve. Having a stronger influence of the vagus nerve on our heart rate. Well, enough of the research, neuroscience research, heavy terminology and jargon. Now, it seems we're a little bit late to the game because there are traditions that have been interested in strengthening vagus tones for decades. Any tradition that focuses on the breath, that asks you to pay attention to the pace of the breath, that encourages you to breathe slowly, is actually tapping into and effectively strengthening our vagus tone. Having made the case of the vagus nerve is really important to resilience at the biological level. Okay, let's start to take home. I have a quick exercise, a practice that I would like us to do. Let's start with a quick practice, which does not have any particular orientation or spiritual kind of connection. It's just simply a way to notice and perhaps strengthen your vagus nerve, something we can do anytime when we're feeling a little bit stressed. We can just do that. I would like everybody who is here with us, relax your shoulders, please. Maybe put your hands on your thighs, assuming you are sitting somewhere comfortably for the next 6 breaths. Now, try to inhale a deep and thoroughly breath to feel your chest and your abdomen. And when you exhale, let your exhale be a little slower than your inhale. Take a little more time to exhale. If it helps to count, we can. So if you're all ready, let's start. So if you inhale for 6, and I will count. Now let's start together. We inhale for 6. It's sorry, before that, it's very important that we know how to breathe properly for these exercises to be effective. Because sometimes some people just breathe into their chest, but we know when we're breathing, our abdomen and chest fills up, and that's what we have to experience. So together, we're going to inhale 6 for 6 seconds, which I'll count, and then we'll inhale for 9 seconds, exhale rather for 9 seconds, which I will count as well. So the longer we exhale, the better it is for our engagement with the vagus nerve. Okay, let's begin. We inhale for 6 seconds. 1, 2, 3, 4, 5, 6. And exhale for 9 seconds. 1, slowly. 2, 3, 4, 5, 6, 7, 8, 9. Now let's try that again, please. So we inhale for 6 seconds. 1, 2, 3, 4, 5, 6. And exhale for 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. We're actually engaging our vagus nerve. If you have been to a yoga class or some kind of mindfulness or meditation or centric prayer experience, where again the guidance has been to really pay attention to your breath and perhaps slowing a little more deeply than you might in habitual way, then you are exercising your vagus nerve. And we can do this anytime. If you're a parent, one of the fun ways to think about this is to encourage children to imagine that they are blowing a pinwheel, or maybe even blowing out birthday candles, and they have a lot of them to blow. These are ways to bring to real life these practices that we actually know physiologically helpful for our resilience. So this is a short exercise here, which it's very effective if we try and do it regularly. So in case of, in the face of adversity, the body is already used to regulating itself. We can share now. We open the floor for questions and answers and comments.
I'll just make a quick comment. I enjoy meditation and yoga, you know, and we do encourage that. We have yoga and meditation workshops with sickle cell cause, because we know the importance of it. In fact, Leanne is a yoga basu, so she, you know, even at home sometimes I'm forced to when I don't want to, you know, to help me to manage pain and that. So yeah, I know the benefits of it, and we do have it in our community. There's a sister called Sis Anna. She's a sickle cell supporter, and I remember mentioning it last month. She hosts meditation 9 o'clock every morning via what's that thing, Instagram, you know, and we have the link, so everybody in our support group that's on WhatsApp or on Facebook and that, you know, is aware of, you know, the benefits of meditation, and they should join on her classes. I think Leanne's there. I don't know if she wants to add anything.
No, we're open for questions and comments for Daniel.
Hi.
I think that you was very, very what do you call it, self-explanatory anyway, right? So because of time and nobody seems to have any questions, I do know that we do have a couple of let me just share my screen, that will make it easier. We do have a couple of sickle cell warriors and supporters in our group that would like to say something. So at this point, I'm going to ask, first of all, Carl Supreme. Now he does a lot of our videoing. He's on our Save the George Miles Centre committee. He's been a volunteer, and he's a great support network since 2005 with sickle cell support. You know, and I know he wanted to share something. So Carl, if you can unmute yourself, if you're still there. Yeah, he's there. Let me unmute him. Hello?
Yeah, can you hear me?
Yes, we can now. Yeah.
Okay. I've got to say good afternoon to everybody. I'm at work, but I'm still listening and tuned into the program today.
Thank
So I
you.
hope everybody's fine and in good health, and you know, and going through the challenges. I've got to thank Professor Dyson, also Daniel, for their presentations and yourself. I'm getting digital interference as well.
Yeah, I don't know why
Hello?
that interference. I don't know why that interference keeps happening. We've never had it before, you know. So I don't know why that is. But what was it that you wanted to
You know
share with us
something? I
today?
just wanted to just say, you know, just to talk about how long I've been dealing with sickle cell, and that my I've got a little bit of a personal opinion that I think that more sickle cell warriors have to start standing up and showing themselves and being a bit more visible, because the challenges. I'm getting. I hear you, you know. Hello. Hello.
Yep, we can hear you.
We can hear you.
Oh yeah, I don't know, because I keep getting this digital interference.
Yeah.
Yeah, so apologies if I sound like I'm, you know. Yeah, so one of the things that I'm kind of, this is just my personal thoughts, and looking at the years that I've been around in the sickle cell community, with sisters such as Sharon Edwards, Leroy is probably, I can't hear. Hello? Yeah, I don't know if it's someone's microphone or something, but it's really just cutting straight in. Hello?
Yeah, we can hear it as well.
Oh yeah. So I was just mentioning my journey with sickle cell, and today, to see today that I think that the sickle cell community needs to be a little bit more visible. Not saying sickle cell cause, but I think that, you know, with people going and campaigning. Hello?
Yep, go ahead.
Yeah. Are you picking up that noise as well, or is it just me?
No, yeah, I think we're all hearing it.
We're all getting, yeah, we're all picking it.
Yeah, well, I'm just saying, well, I'm just going to cut it short, because I just think that the sickle cell warriors
just one second, please. Can anybody that is not speaking mute off? That way there will be no interference. Everybody that is not speaking, mute off. Let the next person, perhaps the chair can come in here and moderate it, and that anybody that's going to, and they put the mute off. Otherwise the interference is really bad. It's really affected the whole conference throughout.
Hello?
Yeah, I had everybody muted, so I don't know if that's the reason, but yeah.
No, I just think it's the technology of today and what's going on in the community, because other people are facing challenges with digital interference and stuff like that. It just so happens that we're using it, and it's happening a little bit more today. Yeah, so my personal just thing to say that I would love to see, because there's quite a few other people that I know who are sickle cell warriors, but they're very quiet. All right, I'm going to leave it there because it's just cutting in.
Personally, thank you, Carl. I get what you're saying, and I fully understand. You're not asking people to sacrifice their life, but be more visible, you know, be more active, even if it means completing forms and sharing information, you know, that's activity, you know. So I do understand what you're saying, appreciate what you said, and I take note.
Am I muted still? It kind of goes with what the professor was saying. If we don't have the data, and if we don't have the people speaking out, I think other people were making decisions, and you'd just be marginalized, because no one's really what is it? The service users is not standing up, and I think the service users in sickle cell have to stand up. Otherwise, there'll be just more outside decisions made for them.
I can't agree more.
Pardon?
Okay, Carl, thanks very much.
Yeah.
Okay, moving on. Thanks again, Carl. Moving on, I know that Sister Christine wanted to share something as well.
Thanks, Sister Samantha. Hello, everyone. Sorry to interject earlier on into the person speaking. It's just that the interference was so bad I could hardly hear anything right from the beginning up till now. You know, the interference was so bad. It's crackling. I don't know. Right. It's a bit frustrating, but here we go. I'm just going to try as much as I can. I think what I was asked to speak on is the impact of COVID-19 on my son and myself. My son has sickle cell disorder or disease, as they call it at the hospital, and I am a trait. I have the trait of it. So does my husband, which is the reason why our son eventually has one. To be quite honest with you, for me, the funny thing is that even before the school was shut down by the government, my son's school sent him home because they could no longer care for him and keep him safe effectively. And also, a lot of teachers in their year were self-isolating for one reason or the other. So for all the year 9, initially it was for him, it was asked to for me to look after him from home for about a week or so, and then 2 weeks later all the year 9s were sent home because there wasn't enough teachers to look after them. And then of course the government shut down subsequently. So effectively we've been at home isolating from about end of February, early March, so to speak. It has been difficult. It has been very tough. As a mother looking at your child, trying to make sure that you keep them sane, trying to make sure that you keep them hydrated, you keep them fed. My son is quite independent. He can do a lot of things for himself. But when it comes to his emotional state, he's also a very, very tactile person. He needs cuddles. He needs to be embraced. He needs all those things that most children that are tactile, and that's just his nature. And it's something that I believe that is developed. So it's been extremely difficult for him not to be able to come close to me and give me a hug or ask for a hug or for me to hug him. That aspect of it emotionally has been very, very difficult. And I'm sure it's affecting him emotionally, albeit he doesn't say everything that is going on in his head to me, but most of the time I make sure that we talk every day to try and find out, we call it family time or socializing time. If it's not talking, it's about watching movie or doing dance to some of his music, because one of the things that is distraction is music. Fortunately for him, he plays a few instruments, and fortunately for him, he's also composing music. So that has been a saving grace for us this lockdown. So he's been able to focus on that. He's been able to meet a lot of other producers online, and he's learning a lot, and he's doing a lot of things. But nonetheless, there was a time, there was a really dreadful time that I had to self-isolate from him because I believed I had the symptom of COVID-19. That was extremely, extremely difficult. And sometimes I'm afraid because of his nature, I had to shout to make sure that he doesn't, we maintain the social distancing in the house. And that really hurt him. I know that it hurt him, but I had to keep him safe in a home environment. I know what the rules say is about. If you've got somebody that has got the symptoms, that they should even self-isolate from the people. People talk about it on the TV, but unless you've experienced it, you don't really know how difficult that is, because it means you can't eat together, you can't stay together, you can talk from one room to the other, but you can't be in the same room at the same time. So that was an extremely difficult time for us. And it did affect him, and I'm sure it affected me. And I can tell you the way it affected me was that I would hide myself in the toilet and I would cry as an adult, because I can't touch my son. Nobody can come into the house. I can't go out. And that is just me. So how much more my son, the impact on him. But we, you know, fortunately we have a faith. We believe in God, and we pray together. He prays by himself, I pray by myself, but we also come together to pray. And that's been a saving grace for us as a family as well. In terms of, I remember registering for, in terms of getting shopping, that has been an experience in itself. My cousin, who also works for the NHS, is able to help us, but she can only do it when she wants to do her own shopping, and she didn't shop every week. So, and I'm so grateful to her because she still does it whenever she can do it. So I had to register with the volunteers, Essex Volunteer Service or something like that, to provide us with the government to provide us with the basic that we need. Not that we needed everything, we didn't need everything, but so what they've provided to us was really, really very, very basic. A lot of tin food, but it helped us to manage through the periods that things were really tough and hard. In terms of medication, we weren't able to get anybody to help us get medication. The Tesco, we use Tesco's family, and they don't do delivery whatsoever. So it's funny, I just received a letter from my local council that they are there to help us. In fact, this week, this is after being at home for about 14 weeks or more, saying that, you know, we need to email them if we need it, which I did, because one thing that we do need support is to pick up our medication. But whilst during the lockdown, we couldn't. I was forced to go out and get our medications myself. I was forced to go out at some point, just once or twice. One was to shop and get medication. The second occasion was to get my glasses fixed because all these screws were coming off for whatever reason. Maybe it's because of a lot of usage, because I'm in the house a lot. I had to, but on each occasion when I gave out, which was the first time I went to pick up prescription and did some shopping, was when I think I caught the virus at the shop. And I was really locked down for about 2 weeks. It was no fun. It was not fun. It was not a joke. But by the grace of God, we came through it. And that was when I had to enforce the social isolation for myself and my son, between myself and my son, which, as I told you earlier on, was extremely difficult. I think I've said about that it affected him, and I'm sure it's affected him as well. But what we need to know, one thing I can say is that, Samantha, I'm not saying this to embarrass you. I just want to say to you that I really appreciate you, because you came, you not physically, but you came, and you will call me, you will text me, you will sometimes email just to check on me. I know I do the same for you, but I'm not a sufferer. I'm the one that's supposed to be looking after you, but you're the one that is checking up on me. So I really want to say thank you, Samantha, for all the work that you're doing, for not just for me, for everyone, and all the carers and the parents of the and the sickle cell sufferers, warriors themselves. So I want to say thank you for all that you've done, all that you did for me and my family, particularly at this difficult time, and all that you're doing for all the other families out there, despite the fact that you go through the challenge yourself. So thank you for everyone for listening. God bless.
Thank you, Christine. Yeah, you did embarrass me. I know you didn't mean to, but that's fine. I do appreciate your words. You know, as I said, it's my passion, and I don't work alone. I mean, I couldn't manage to do the type of work that we do if it was just me alone. I am supported, like, with people like Carl, Leanne, Carol. There's a whole host of us, and all, you know, to get things done. But thank you for saying that, and I understand what you're saying. But I have a question for Daniel before somebody else speaks.
Yeah.
Right. Christine mentioned, like, Christine, you mentioned that, like, you went out and you believe that you got the virus by going out, right? Now then, you've got the government talking about this track and trace, or trace and track business, you know, where you're on the phone, you know, people that's in your phone, you know, so I don't know how this can work. is in my phone, you know. So would she, the fact that she's been, you know, whatever, will it affect me because we're in the same phone? And also, what about the NHS staff? NHS staff are around people that have been positive. So how come they're not meant to be self-isolating? I don't understand how this track and trace work, and I find it very traumatizing. Do you know anything about it, Daniel, or does anybody know anything about it? You know,
I don't really know anything about track and tracing, how that works. But I know if I come into the country next month, if Ryanair is flying, if I come in next month, I'll have to fill a form at the airport. They'll see my isolation, my quarantine address, so where I'm gonna stay. So randomly, they will check on me randomly, and I think that's an automatic system. It can't be people sitting down there calling because there's too many people. So it will be it has a tracking system which is electronic. You know, the numbers will be fed in. Obviously, if you fill the form, yeah, they'll be fed into the database. But then this tracker randomly will pick a number and call from time to time to check on you within the 14 days that you're supposed to be at home, self-quarantine. Okay, this is what I know. But I know with regards to because I'm in Germany here since March, 21st of March, and I get my correspondence from the NHS, from the shooting team, and all that. You know, and they called me even here, and I told them I don't need anything, but I'm safe. That's the main thing. Now, regards to medication, the local council is supposed to do that, and there's also an NHS sent out a number that people can call. People who live alone could call and have medications delivered to them. So I don't know why Christina had to go out and, you know, risk herself to catch the virus, you know. And so this is what I know. So I thought, well, I'm not in the country, but actually I'm well fed, you know, with information. I know what's happening there because I'm on the system. My GP called me as well, and I said, look, I'm okay. All right. I'm okay. The main thing is you need to be safe, so you can update the system that I'm safe, and that's it. You know, so I'm surprised that you are in the UK and you did not, Christine, you did not get, you know, help to get your son's medication.
Sorry to interject. I've just received a letter from my local authority that is supposed to help me. I received that letter this week.
That's too late.
That is a bit late.
Yeah, because I got that information about 2 months ago.
I only got mine this week,
that's late.
and they asked me to register, and I've registered. And even up till now, I haven't heard back from them.
There's something wrong somewhere. Yeah, you know, all the hands are not the same. Some people work different. People work differently. So it could be a mistake somewhere. Because it's right unfortunate that you have to risk yourself, you know, to go out there.
But what do? You've got a child that is a minor. You've got to go. Yeah,
I know. You know, but that's what I'm saying. That, you know, it shouldn't have happened. You know, if you had help, you know, it wouldn't have happened. But that's behind the case. That's on the side. Right now, we have to look forward. How old is your son, by the way?
14.
How old is your son, Christine?
He's 14.
14. So at 14, yeah, he still has a lot to learn about the illness. You know, and I think you're doing a good job supporting him, reminding him to keep his distance from even the family members and people from not contacting anybody, but keep his distance from you.
I'll just interject here because we did have a comment from another mother who has a son with sickle cell, and this is to Christine. She was asking how old your son was, which has just been revealed. So it would be nice to get you guys connected. Maybe your sons can share their experiences and, you know, build a friendship. Great, perfect. Also, I remember earlier, I think it was Hilda. I heard her mention that she's part of her child is part of a WhatsApp group where they have updates on activities and stuff. So it may be good to, if we could connect with Hilda on that as well, to get your money connected into that group. Would be good.
That'll be great, Lee. All right, I'm thinking now. It's time to draw this.
really know?
Yeah.
I don't know why. The volume has just gone down, and I don't know why it has gone down. It's not. I put it on speakerphone, so I don't really know what happened. This is part of the problem that I'm having with the phone. I don't know.
Yeah.
Can you still hear me?
Okay, I'm just
Yeah,
probably
yeah, we
hear
can
me?
hear you now.
what people are.
Okay. I think maybe we should just carry on with the meeting. We can maybe have a chat about peer-to-peer support for the young people, for the young warriors. That would be fantastic thing if it is possible to set one up, or if there's an existing one for all our children to be able to access.
Oh, great, perfect. Definitely do something with that. Okay, Sam, I'll let you continue.
Is that me?
Yeah.
Oh, well, basically, we're at the end of the meeting now. It's just that anybody's got anything to say. But the point, what I'm saying is that we can't hear anybody. It's not good. So we might as well just end the meeting now until next month. It's been a brilliant, very informative. Oh, thanks, Professor Simon, on behalf of us all. And again, Daniel, you was definitely, so thank you there. Everybody that commented in the comment box, everybody that participated, and everybody that's in attendance, you know, thank you so very much. You know, and we'll see you next month at Sickle Cell Cause's next open house. And also before our next open house, we will be having the memorial for Neville, and everybody will be informed. And if you knew Neville personally, we would appreciate if you will contribute tributes, you know, for his family to keep for prosperity. And I will add that his book, you can't buy it anymore, you know, but we do have one of our sickle cell supporters, Maya Bednall-Greaves, who will be reading the book. She started reading it and recording it, so we'll be able to share drafts of the book in audio, and we will keep it in our audio library, which we will add to our website and so forth. So everybody will have the book, you know. So his memorial is on the 18th of July, and our next open house is the 20th of July. But everybody will be informed of the dates. And again, I want to say thank you to everybody for your attendance. Thank you for taking part. It's been wonderful. I love my community, and please have an enjoyable evening and a great week ahead. Thank you.
Thank you. Bye-bye.
Bye, everybody.
Thank you all.
Bye.
Thank you.
Thank you all.